Access to Medicines platform is a non-profit organization which works with partners and multi-stakeholders in contribution to achieving sexual and reproductive health and rights. Our multi-stakeholder approach is different as we go beyond just talking about issues. We facilitate roundtable discussions between multi-stakeholders from private, public, mission sector, academia and CSOs network to generate innovative solutions to the tough problems of supplying the right services and medicines in hard-to-reach areas and marginalized groups at the right prices for the right quality and in a timely and accessible manner. We support national and county-level multi-stakeholder dialogue space which strengthens governance and promotes the rights-based approach. We also provide high-level strategic multi-stakeholder partnerships to lobby and advocate for strengthening policies and processes that support reproductive, maternal, newborn, child and adolescent health. Over the years, we have had several multi-stakeholder engagements that have yielded great outcomes. In partnership with our national CSOs partners, the Health Rights Advocacy Forum, HERAF, we held a feedback forum in Isiolo County that created a platform for the discussion between the county health management team and CSOs on the status of the Universal Healthcare Program implementation in the county. We have also conducted other multi-stakeholder engagements in Narok, Kisumu and Kakamega counties. The main objective of these forums were to share our findings of the study on availability and affordability of SRH commodities and review their recommendations and also develop a joint action plan to improve access to these commodities and reduce incidences of teenage pregnancies, maternal deaths and STI infections. In the Kisumu Dissemination Forum, various leaders of the county committees were also present and expressed their gratitudes to Meta Kenya for conducting the research and doing the dissemination.
Well, the study on SRH commodities availability, we welcome it, and it's quite informative because it actually shows us which areas that we are weak on and we need to work on, like when we talk about SRH commodities stockouts, availability, and this means we have to plan and budget for certain commodities, and basically it only shows us which areas that we really need to exploit.
And you talked about sensitization of people on matters of SRH commodities, and we are thinking as an assembly right now, and it's going to happen very soon. We're going to have what we call Kisumu County Community Health Volunteers Bill. This is what will help us address the issues of CHVs, who will help us in sensitization of communities on matters of SRH. I know we cannot take our director to go to SEM to do sensitization, but if we have a bill on how we engage the CHVs, then on issues of sensitization, and if we work closely with other partners, then we shall address the issue of sensitization.
Our biggest consumer is the health sector, but it's not enough because our local revenues, we are budgeting at 1.5 billion, which in essence we need to think of how to raise 5 billion. So some of the shortcomings that we have is because of our local revenues. We are not able to collect enough locally. And for that matter, as we speak now, there is what we call the rates, the evaluation role, which is in process, and very soon want to believe it will be approved by the Assembly. Anytime from now, once we get money and pay those who are handling the evaluation role, then that automatically will change our local revenues. And once we get more local revenues, I also believe we shall be able to address some of the challenges that we are having.
I also want to encourage, as a county, CSOs and the policy makers, the Department of Health. I think you should organize for a joint planning and review meeting that can happen possibly every quarter, where the county is able to share with you their annual work plan and priorities, and you indicate based on that what your contribution is, which then helps all of you to move in the same direction towards a common goal.
To partner with us, please reach us on info@atmplatformkenya.org or call us on 0712 270 458 or visit our website at www.atmplatformkenya.org.